Uh, Hello, everyone, and welcome to yet another exciting Talk About It Tuesday. I'm Brittany Ramos de Barros. I use she pronouns. And in case you don't know who I am yet, I am a combat veteran, community organizer, and congressional candidate running to fight for New York 11 in Congress after we've had a revolving door of leaders who have been loyal to corporate interests and to political parties more than they have been to our communities. And I am so excited to be joined this week with our special guest, Safiyyah, who many of you probably already know. She does incredible work around the community. And today we're here to talk about the COVID vaccine, about people's sentiments towards the COVID vaccine, and what people need to know. So thank you, Safiyyah, so much for joining us.
Well, thank you so much for having us, actually having me join you today.
Yeah,
what can I
it's
say
our
about myself?
I know. I know.
uh,
I'd love for you to just introduce yourself a little bit. How long have you been in Staten Island? How did you come here if you weren't born here? How did you get involved in this work? Give us the whole long version of the story of you.
oh boy. All right. So my name is Safiyyah Abdulkawi. I've been on Staten Island for most of my life. I am actually initially an immigrant from the island of Jamaica. And I came here when I was 11. So it's about 40 plus years now that I'm here on Staten Island. And I'm a registered nurse by profession. So I get to deal with a lot of the pandemic issues that has come across Staten Islanders, especially here in the North Shore, because this is where I work. I also work in the South Shore to some degree as well. Um, and so, being a part of the community, I actually also have a nonprofit that I run, also called Muslim Sisters of Staten Island. And so throughout this pandemic, we have been really working with the community, addressing some of their needs and, just supplementing things that they may need, like for the seniors and for a lot of our school individuals. We also help different worked with different community partners also to, help support the community during this pandemic, because it was a challenge for us for sure.
Yeah, definitely. I know that that's been, first of all, thank you so much for your service as a nurse and as a community member who has been doing so much organizing. For anyone, um, you know, uh, you mentioned Muslim Sisters of Staten Island, and I have not been at a single event where there was tabling or booths where Muslim Sisters of Staten Island weren't there offering up supportive things to community members, whether it was information or whether it was helping to organize, Medicare and Medicaid workers to come and, help sign people up, or just a whole variety of different things. You all do incredible work. So thank you for everything that you do. And, I know that it has been a really hard year and a half, 2 years plus at this point. And I'm curious, as someone who, both on the community organizing side and on the healthcare side, you've been really on the front lines of this issue, like you mentioned. What have you seen in terms of how the vaccine has been rolled out? What were kind of your observations about how that happened and how people have responded to it? And just
Mm.
some of your general observations about that.
I mean, from my experience, I feel like the especially being here on the North Shore, I did see the vaccine rolling out slowly in some areas where some communities got the links easier than others, or maybe some of them were really skeptical of the vaccine, because I've been part of different vaccine conversations regarding
Mhm.
why people don't want to have the vaccine. They feel it's not, maybe not safe. It's a variety of reasons why people especially on the North Shore of Staten Island, um, you know, are apprehensive to get the vaccine. But because
Yeah.
I work in that health field, a lot of people that I saw coming to get the vaccines were, the elderly, people who have other comorbidities that feel that if they take the vaccine, it'll help them and prevent them from getting sick, or even if they do get sick, they won't get any sicker,
Yeah.
or die. Because I think that's one of the fears that many people are having regarding whether they get the COVID virus, or if they do get it, if they're gonna die, and that's
Right.
a lot of people scary. So I have seen different population that are more aggressive in terms of trying to get this vaccine. So
Mhm.
as far as accessibility, I think just seeing what's been happening from the time it rolled out to now, I think there's a lot of communities now really trying to encourage their demographics to go get these vaccines. I don't know how. A lot of people are still very apprehensive though about it, but we also have to understand this virus is very aggressive,
Yeah. Yeah.
and it affects us so differently. And I think a lot, maybe at the beginning, a lot of people wasn't taking it very seriously until they start seeing how it's affecting the community. I mean, and it just went. I mean, it affected so many people. And then I think when things started to shut down a little bit, is when
Mhm.
people started to realize the gravity of,
Yeah.
what this not the vaccine, I'm sorry, the virus can do.
Mhm.
And
Yeah.
I think some people are still um, apprehensive, I guess,
Mhm.
about vaccine, and not understanding how this COVID virus can totally destroy you. I mean, I've known people who have uh, gotten the COVID virus, and there's residuals that have occurred, some hair loss. Some people still don't have the sense of taste. I mean,
Yeah.
it's just been a lot of neurological issues from
Yeah.
getting the virus itself. So there's a lot going on with the virus that we still have yet to know,
Yeah.
and understanding that there are different strains, because people also will say, "Oh well, I already got the vaccine." For those who already have the vaccine, so I don't have to take precautions, and that's not necessarily true. Yes, you can still get the virus. You might just get a different strain, just like when you would have a flu, right? Every year they'll say take the flu vaccine, right? But it's a different strain. If you're not
Yeah.
100% vaccinated, or immune, I should say. However, at least you have a little bit extra ammunition against the virus. So I think that's one of the things that people have to understand. Yes, we don't want, a lot of people conversations saying, "Oh well, I don't want any foreign body, foreign entity in my body." We walk outside, there's foreign entity coming in your body, whether you like it or not. The reality
Right.
is, we have to be smart about things. And so if you don't want to get vaccinated, then how are you going to go about your life? You
Mhm.
know, what's that noise?
Yeah.
So it's a tough sell, for especially for communities that have been experimented on, because we did have a
Yeah.
conversation about that. And so of course the trust is not there. But if you think
Yeah.
about it, I always say, like, if somebody is trying to hurt you, they're not going to give themselves stuff first. And unfortunately, a lot of communities um, that were of non-color got the vaccines first. So that should tell you something. And that's how I looked at it when I decided. And it took me a
Yeah.
while to get the vaccine myself, not because I didn't trust the vaccine, but I did want to see, like a lot of people, wanted to see what kind of side effects may pop up,
Yeah.
you know. Um, so far so good.
Yeah, me too. I had a very similar reaction. And for me, I think that the framing I don't appreciate when people kind of mock folks that are scared to get the vaccine or that are not trustful, because I think that ignores that people have very good reasons to be skeptical and to be trustful, right?
Absolutely.
Like you said, I mean, when we're talking about Black communities and Indigenous communities and just impoverished communities, we've seen all kinds of unethical things that they've been used for testing and things that you were referencing. And yet, what I really do appreciate, you said a couple points that I think are so important that I want to make sure that people caught, which is one is that it's not to say that there's no risk with the vaccine, right? Like it's relatively new, so we'll see. But at this point, there have been millions of people that have gotten it, right? It uses technology that is not new, that has been around for a long time. And it's a weighing of risks, right? We've lost almost 1 million people in the United States alone from COVID, and this new Delta variant is promising to potentially be even more aggressive and deadly. But if you got the vaccine, you might still get it, but it's looking like it's less likely to kill you, right? And so you have this kind of cost benefit analysis of like, maybe there will be some complications with the vaccine, but would we rather that and be able to save lives, right? When we know that this other thing has a chance to kill, maybe not us even, but our loved ones or other people who are vulnerable around us. And so for me,
That is
that was
true.
why. Yeah. So for me, that was why I was like, yeah, I'm skeptical of these things. But, when I think about the risks, like if I don't get vaccinated, the chances are I have a much higher chance of definitely having complications from COVID,
Oh,
what,
definitely. Because now
right.
we're wearing our system down, being out. So now you're gonna do stay home all the time. You don't have
Yeah.
people come over because that can happen. I mean, I know people who was negative for COVID this week and positive for COVID next week because why they had people in their surroundings that came and brought it to them. They didn't even know that because they thought, oh, it's my family, oh, it's my this. Okay, you know, we have to really be smart about I mean, it's your right to not take something if you don't want to. That
Yeah.
is absolutely right. But you also have to understand that by making that decision, how you're gonna, how are you gonna walk around with not being able to, uh, protect yourself or protect others from you. Because
Yeah.
even in healthcare facilities, people who think that they're like, oh, I got my vaccine, I don't have to wear a mask anymore. No, you don't. You come into a healthcare facility, you got to wear your mask.
Yeah.
So, and sometimes people are fuss about it, they're like, but why? I already have my vaccine. Because they're not
Yeah.
understanding the vaccine is not the end all, Like you said, there's different variants to this virus. And so until we really find out more, I mean, yes, I'm so glad that we're able to get out and do more, but like for us, I'm out in the trenches at work, I'm out in the trenches in the community. So I had to make sure that I armed myself,
Yeah.
and protect myself because I was so much with the community and through my job that I had probably great exposure. And I want to take it home to my family?
Right.
Because you don't.
Right.
You really don't.
Right. And that's the thing is even so for folks, cuz it's been confusing, right? There's been a lot of information. I think like everyday people who don't have any background in medical knowledge or I think sometimes it can be a little overwhelming or confusing about who am I listening to and why, right? Like at first I was confused. Like, do I still need to wear a mask? Do I not? So for folks who are confused, why if you have the vaccine do you still need to wear a mask? Like, what are the mechanics of what still wearing a mask can protect you and other people from? Can you like break it down for us a little bit for anyone who might be confused?
So I mean, I can easily just simply put it like this, right?
Mm-hmm.
Because we know that it's not one variant of this vaccine, right? We already got your vaccination,
Mm-hmm.
the virus, I should say, not vaccine, the virus, and it is you can still get it. you could definitely still get it. So wearing the mask will give you a little added protection, at least because it goes into your respiratory system. You're breathing in the stuff, right?
Yeah.
You can get it by that way as well. Just like with allergies, right? I know for me, last year I had no problem with my allergies because why? I wore my mask.
Mm.
Now, if I have an opportunity to take my mask when I'm outside, I'm sneezing my brains out because all that goes right there. It is the craziest thing. So, we have to remember too, our resistance can get low and you be more susceptible to catching stuff, whether it's the coronavirus or a cold. You're
Hmm.
still, our bodies are run down because, stress and so many different changes that have happened because of the pandemic. I mean, it
Yeah.
also allowed us to think outside the box in how we communicate, as well as how we are able to still function in in the COVID land, so to speak. Because at the end of the day, like if we didn't have COVID, a lot of things that we are doing now, having events, having certain things virtually, that probably would be something that they would have been spending so much time working on, right? So
Yeah.
it created some creativity, opportunities for creativity, I believe, But as far as the virus is concerned, I think that we still should be very vigilant in protecting ourselves and others from getting this virus because, as we all know, how deadly it can be. And I don't know. It's hard. It's hard because I have conversations with people who are saying, "Well, how did they get the vaccine so quick?" Right? How did something must be wrong with it? They also have to remember that this COVID virus have been, you know, people know about it. It's SARS-CoV-19. SARS has been around for God knows how long, right?
Yeah.
It's just different strains of it. So they have the information already. So it's when you have information about something, it's easy for you to get antidote, right? So and maybe quicker. And like you said earlier, in technology, we have opportunities because now you have bits and pieces of a puzzle. You can derive things quicker than if you're starting from scratch. A lot of
Right.
people think that's COVID-19 is something new. It's just no, it was in 2019 when it was found. Okay, if it was COVID, whatever, SARS-CoV, whatever year that was, that's what that was about. So it's not nothing new. It's just how do you say, evolved into
Right.
something different. And
Right.
so we have to understand that and know that it didn't happen yesterday.
Right. Exactly. Yeah. I mean, and the more vaccines that have been developed in the past, the more chances there are that when there are new strains or new diseases, if they have similar qualities as things that we already have vaccines for, then it's easier. It's a smaller jump, right, for them to be
Right.
inventing it. That's what I mean. That's what you're speaking about. That's what I mean when I say it's based on existing technology, is they didn't have to start from scratch, right? They said, oh, this
Absolutely.
operates in a similar way as these other viruses that we know. And so let's try the approaches that we already know work for those
Have
and
in
see if they
place.
work for this, right? And just tweak it a little bit
Absolutely.
so that it works for this. So that's something I think is misinformation that has been spread a lot that I think is really important to highlight. Um, and, I mean, we've come such a long way on vaccines since the very first vaccine was invented, right? Like when they had to invent
Yeah.
the very first vaccine, they had to figure out everything about it, right? How do we get it
Yeah.
to work? How do we deliver it? What is right? How do we store it? How do we distribute it? Right? Like all of those things they had to figure out brand new. Most of those things are figured out now. So all they have to do is figure out, okay, how do we tweak it to work for this new variant that we, don't have a specific solution for yet. So, yeah, that's a
I
really
think
helpful to highlight.
I think too one of the reasons why some people may be hesitant is because this particular virus um, has 2 or 3 different vaccines for it. So they're
Mm.
like, so there's conversations where people's like, well, the Pfizer versus the Moderna versus the J
Yeah.
and J, right? So it gives them opportunities also to figure out: do I want this one? Do I want the expensive one that has to be stored a certain kind of way? But then, because if you really think about it, the Pfizer has to be stored in a certain way, right? And
Mm,
only certain organizations and certain types of communities will be able to have access to that. So
yeah.
then people start thinking like, what? And then the Moderna, which is an easier, way to store and access to, people like, oh, well, why are we getting this? Why can't I get that one? Because
Right.
I've heard that, right? People was like, why can't I
Mhm.
get the Pfizer? I was like, you can go get the Pfizer. I did, you know, but because looking at different reactions from different population as well, could get people to understand like, okay, maybe this group, responds to this vaccine versus this group. And
Mm,
these having these three different vaccines actually has given us opportunities to see what population and what or even and or demographics and people respond to these types of vaccines.
mhm.
Because as you know, with even with medication, we every indigenous people versus Caucasian does not respond the same way.
Right.
They really don't. So it's like but you don't know until you try it. It's like it's not one size fits all.
Right. Yep. Yeah. And too often there isn't really a dedicated focus or resources put towards studying those differences, right? Across different populations, even by sexuality, right? I think I saw a thing that was like the dosages for most prescription medications were only tested on men. And so
Hmm.
there's growing evidence that like the dosages are all wrong for women in the way that they've been assigned,
Absolutely.
because they never studied us. They never even bothered to be like, oh, let's see, And so we're still, there are those structural discrepancies in the science and medical fields that we're still working on, closing those gaps, right? Or making sure that we check some of those biases or assumptions. Um, and then,
Right.
another thing is distribution, right? I mean, we've seen in the news, for anyone who's been following the news around this, I think that it's abhorrent that something that is so life-saving is being kept private, and that corporations who used government public resources to be able to develop this are then able to say, no, we're not going to distribute this to other countries, for example, that need access to the formula to even just make their own, right? And so we see
Yeah.
all kinds of medical equity issues um with that as well. I'm curious if you have any thoughts about that, or if you've been following that in the news.
I mean, I've listened to couple of one second
You're good.
allergies.
I was gonna say, now anytime
There
anyone
have been
coughs, everyone's like, oh no, are you okay?
allergies. Yeah, allergies has been an interesting thing this year for us. But as far as equity, I still believe that we can be even more equitable. If you have a surplus of anything and you can give, why not? Why not? Why should you let other people suffer because you want to hold on to something that's not going to do any good for you? Like
Yeah,
that doesn't make sense to me. Um, and I know that affects a lot of the poor countries that can't afford X, Y, and Z.
yeah,
So it all goes back to, if you're poor, you can't get what you need to survive, right?
yeah, yeah.
So it's that's not equitable.
Mm-hmm.
You know, people have problems understanding the difference between being equal and equity.
Yeah,
And with the vaccine situation, you definitely equity is definitely it needs to be done. It needs to be done for different communities. It doesn't make sense for you to hold up something that can be benefit to others, because at the end of the day, if you don't get it done, that population is going to suffer more, and then that's that financial backlash that happens with that, right? So you have more sick people, people, then it's more strain on the healthcare system. But then we complain that there's so much money going into healthcare, but it's just like that crazy cycle, right? That
Yeah,
you're like, okay, we're spending X amount of money on this, but
right.
we're not spending enough money for prevention.
Exactly. Yeah.
So then,
And it's costing us
who's
more in the
benefiting in this loop? Who's benefiting in this loop? Is it the pharmaceutical companies or is it the community?
end. Yeah.
Hmm, that's a question.
Mm-hmm. It is a question that we need to be asking
I
a
don't
lot.
know. Who do you think?
Yeah. Yeah. We were having
Yeah.
a really good conversation just the other day about the fact that, I was speaking with Reverend Antoinette from the Central Family Life Center, and she was, talking about food deserts, and we've talked about that on Talk About It Tuesday before. But another thing that we don't talk about is medical care clinic deserts, essentially, right? Is like where, and from, I have the question, I'm like, I don't understand why there's not a grocery store with healthy food, a gym, and a medical clinic in every housing authority, right? In every, like, anytime you're building a development with apartments, like that shouldn't be reserved for luxury apartment spaces, right? They get to have those things. And if we had those things, that would contribute, that would end up saving us money on healthcare in the long run, because it would be an investment in some of those like proactive or preventative healthcare measures, making it accessible to people.
That is actually, that's a great idea. However, do we know how many people actually access that?
Yeah. I mean, that's a question, right? But it's like, what I do know is that if you live in an area where there's no doctor's office that's an affordable doctor's office that takes either your insurance or is affordable if you don't have insurance, whatever, like within a multi-mile radius, then like it's much more, people are much less likely to go to the doctor for proactive or preventative care. So I think
That
we
is
just
true.
have, yeah, we have to be brainstorming, right? I'm not saying that that's
Right.
the end all be all, but like, what are just some of the basic ways that we can think about making these things more accessible to people? Is something that
I mean, because they do have that. They have that for, they have that for those retirement homes, right? They got the exercise. They got the chef. Not to say we need to have a chef, but just different things that will. Hey,
yeah,
you can even teach people how to cook healthy meals, right? You can have these different pockets of workshops and empowering that particular community, right, to
mhm,
have better and healthier lives. Absolutely. I totally agree with you on that. Yeah, I think it's important for us to, like you said, think outside the box. Like, how can we
mhm,
help our communities develop in a way that they can self sustain and be empowered to manage their health, not only their health care, but their education needs as well. And that's
yeah,
where I feel that equity portion will it will even out, because then everybody's feel like they're a part of the process. I think a
mhm,
lot of times some of our black and brown communities feel like they're just going with the flow, so to speak, because nobody wants to listen to their ideas, or whatever they may put out. um it's not taken seriously, right? So they're
yeah,
like, well, why do I even bother, you know why do
yeah,
I even bother? But I mean, what you just said now actually could even give people some ideas about how can they make their community better, and how can they empower themselves even more so to strengthen what's going on within them, and have even more control over, what's coming into their bodegas around the corner. Because, it's always supply and demand, right? So if they give you stuff that's not good for you and you buy it, they're going to keep giving it to you. But
yeah,
if you don't buy it, as you can see, a lot of companies, they like, okay, they do that, those analysis every quarter to see which items are selling, right? So
mhm,
if we stop buying the garbage, then we won't get garbage.
yeah,
If we'll get healthier foods in our corner stores, yeah, we're gonna have a little, snack here and there, but
mhm,
creating that environment where you have even farm grown foods come to right next door,
mhm, yeah,
on a daily basis. Yeah.
yeah. Yep. And we need more of that, because it's a vicious cycle, right? It's like exactly what you said. Like, if there's only garbage in the store that's close to you, then that's what you buy. And then people point to that
Hmm.
and say, oh, well, that's all people want, right? And it's like, well, no, like,
Exactly.
a lot of time that's all people have had available to them or all that they can afford. Um,
Yes.
and so how do we address those issues, right, at the root? And I know that some folks like Sarah Bloss and Sarah, there's another Sarah who I know through the community fridge. I forgot her last name, but she does incredible cooking, exactly what you were describing, cooking programs,
Yes.
right, that are funded. And some of that is funded through the city, which I love. I think that that's so great. And they use farm fresh vegetables from the local co-op farms that
God.
exist in Staten Island. A lot of people, I think, would be shocked to hear that
Even the
there's
community,
several farms here.
even the community gardens. That's an
Yep.
other opportunities for the community to go to their own garden and get some stuff. They have the harvesting week or whatever. I know Help for Youth has one here at Skyline Park, not too far from me. I know Sarah has her garden, and there's so many different pockets. We can teach our communities how to grow our own food. The kids love it. I remember when
Yeah.
I did it with my summer camp, and they just love digging in the dirt and understanding where these foods come from. It didn't come from the supermarket. It
Mhm.
started somewhere. Even just how to plant a seed and watch it grow. That
Mhm.
is that's just a beautiful thing. I know we're talking about vaccines and we're talking about, but this is a part of
Let's
what we
connect.
have to do to talk about. Exactly. They're definitely connected because it's all about health, right? It's healthy
Yeah.
foods, it's healthy things that, and then we have to protect our health and where we have an exposure to something.
Yeah.
And so, but if we have weak bodies, weak immune systems, we're even more susceptible to getting some of these opportunities, opportunistic diseases that's coming around.
Mm-hmm. Yeah. Yeah, absolutely. And I mean, this conversation leads me to, I think, a good transition point for another question I wanted to ask you, which is like, I think a lot about, we often as individual community members or as community organizations, we step up and play a really important role around some of these issues. And sometimes I have questions around, sometimes we're handling things that I think should be handled by governments that are actually serving us, right? That we should be getting the government to actually offer some of these things as benefits. And sometimes they do, right? We've named several programs that are examples of that. But I'm curious, when you think about what should be the role or what can community organizations be doing in terms of engaging with community around the vaccine, around accessibility, around dispelling myths or misinformation. How has Muslim Sisters of Staten Island been thinking about that and approaching that in the community? And what are some of your thoughts about things that other community organizations can be thinking about in terms of the role that they can play in this moment that we're in?
Well, I think that most of the community organizations that I've been involved with have been really pushing out, uh, information about the vaccines. Even just the COVID testing alone, I think that
Yeah.
more people got COVID tested than people got COVID vaccines. Because they had to. You can't get any place without up. You don't have proof, can't go. So there's some barriers that prevents us from doing what we need to do. But as far as the community base, I think they just keep educating the community, keep giving them the support that they need, helping them understand about the vaccine, and make them feel comfortable about taking it. You
Mm-hmm.
know, and if they still don't, and it's okay, but you still got to do your due diligence and understand that
Oh, I think it froze. I'm giving it a second to see if it comes back.
and
Uh,
we lost connection for a second there.
yeah,
That's okay. Technology, right?
yeah, technical
Yep. But
difficulties on live streams is just part of our new normal now. Post COVID.
exactly, exactly. But I think education,
Mhm,
keep having the trust of the community is important.
mhm,
I know what's it, Central Family Life Centers give out a lot of the vaccines,
mhm,
CHCR, several different pockets to the point now that regular community hospital and other places that was giving it out before. Now they're like, you know what? There's more satellites in the community now, so we don't have to overrun staff with
Mhm.
giving out these vaccines. The community, it seems like the community now is going to take charge of themselves, and I think that's important for
Yeah.
us to be in charge of what we bring into our spaces in our demographics, because we know those demographics and how they're going to respond to certain things. And so maybe having those satellites within the community, they can have more trust because they'll go to spaces and places that they trust, that they'll give them the right information or resource. So I think leaning towards that may be a plus. I know
Mhm.
there's a lot of incentives that the governor and other people are trying to do to just to get people to have the vaccine. And then there's conversation I'm hearing like, if they're so interested in giving me all this, what what something must be wrong. Those are conversations as well. But the idea
Yeah.
is sometimes people need a little incentive to do things, and we rather it be a good one, not a negative incentive. So
Right.
yeah.
Yeah. Well, and the negative incentive is already like you could
Mm,
potentially die if you don't,
I don't
right?
think you
Like,
can get any more negative than that.
right. Or people around you, right? If you are less likely, or more likely to have a strong immune system or be young or whatever, but um so yeah, I think that that's so important. And I also think that, like you said, like having trusted community messengers who can say, because there's some folks who, no matter how much education and things like that, they're just not going to trust it coming from the government or coming from certain places. So I'm so grateful for how many community organizations we have who are doing work within our own different communities, to be trusted messengers to talk to each other about it. I think that that's so important.
Definitely, definitely. It's definitely important for us to continue to educate the community, encourage them to do what they need to do to get back to some. I wouldn't even say back to normal, because I think we all are sure that we have a new normal now.
Yeah.
Um, but we have to be mindful that we're not out of the woods yet.
Hmm.
So we have to basically thread lightly, but
Right.
still have a life. Because I know there's other things that popped up because of this pandemic. You know, um, a lot of mental health issues have
Yeah.
came out from this, and including some of the increase in domestic violence, and other types of violence towards women and
Yeah.
children. So we have to be, we got to be vigilant in making sure that those things are still being addressed and supported, where needed, because
Yeah.
it's more than just health. It's more than just physical health residuals that comes from this pandemic. It's so much more. It brought out so much more in the community, good and bad,
Yeah.
that we have to really take a look at to see how can we fix it, at least, or at least keep it to a bare minimum.
Yeah.
So yeah.
Yeah. Right. Yeah. A lot of those root cause things that you're speaking to, as well as just like what infrastructure we need to build, I mean, that's something I thought about a lot. It's just like, gosh, like this really shined a light on how much we need to invest in public health infrastructure.
Absolutely.
That is not just about, not even, I mean, we need public health care that is genuinely available and affordable for everyone. But we also need public health infrastructure in the case of a public health crisis, right? Which is what we experienced here, which
Just
is
that.
different from individualized medical care, right? But literally like investing in having a disaster response team essentially that is actually fully funded and equipped for these situations. Like, it's wild to me that we had we had that infrastructure, but it was just gutted, right? It was defunded and gutted for years at a time. And then when we really needed they just didn't have the capacity that we needed them to have. And, I
And
would
the
love,
community wasn't prepared either.
right.
Community wasn't prepared.
Yeah. Yeah, exactly. So, this has been, I think that we've touched on a lot of really important things. I'm curious, is there anything else that you want to make sure to share or make sure that people know while we're here?
No, not at the moment. I mean, I think we talked about a lot of things that we have to hone in on and continue to, you know, support and let the people know that,
Mhm.
there is support out here for them, and
Yep.
just there's resources, and just keep, you know, protecting yourself from things that will cause you harm.
Yeah, absolutely. Thank you so much. And if folks do want to get involved in any of the work that you mentioned, particularly the work that you lead with Muslim Sisters of Staten Island, what would be the best way to look you up or to get involved in that?
Um, they could just reach out to us at Muslim Sisters of SI at gmail.com.
Okay.
And I could actually type it in if I can. I'll just type it in the chat.
Okay. Yep. I think we can do that and we'll drop it in the comments for anyone who wants to join and get involved. All right. We got
That'd
it.
be great. We're always looking for volunteers or anybody else who want to come and join the team. So absolutely.
Awesome.
Yeah.
Awesome. And can anyone join or volunteer, or are there particular membership criteria? Like, do you need to be a Muslim woman
No, not at all.
okay, so anyone can volunteer. Okay.
Everybody can volunteer. Yes, absolutely.
Awesome.
Yeah, we have a couple of events coming up. So yeah, we're gonna need a lot of volunteers to help out.
All right, great. Well, we'll keep that in mind too. I know we have a crew of Team Brittany volunteers, and we try to show up and support where we can. So
Yes,
let us
thank
know
you.
about that as
Yes,
well. And
I will.
awesome. And I think I'm checking, but we dropped it in the comments already. So if you're watching live or if you end up watching it after the fact, check the comments for how you can reach out. And of course, follow Muslim Sisters of Staten Island on social media. And if you just search for it, they'll pop up their purple logo. um, and Safiyyah, thank you so much for coming and sharing your experience and your insights about what we need to do and how folks can get involved. I really appreciate it.
Well, thanks for having me.
Of course.
It was a pleasure.
Awesome. Thank you. All right. Take care, everyone. Stay safe out there and get
Bye.
vaccinated.
Absolutely.